This is Jeff Mucci with RCR Wireless News, and we're here today with Scott Sanford. And you're here for South by Southwest Interactive. What brings you to town?
Well, what brings us to town, Jeff, is the launch of our new smartphone app. So we're very excited about this, excited to be here at South by Southwest at the Digital Health Conference. So we're announcing to the world the taking Healthiest You to the next level.
Tell me about the company, Healthiest You.
Sure. So what we do is we make it easy for individuals and employer groups to understand benefits, navigate through the somewhat complicated healthcare system. And at the end of the day, we save employer groups and individuals a lot of money around healthcare.
How?
Well, it's pretty simple. First off, we offer access to a nationwide network of board-certified physicians. So we're live in 48 states. So for acute issues, colds, flus, infections, and so on, instead of going and seeing a doctor face-to-face, it's proven that over 70% of your healthcare needs can be safely and effectively resolved right over the telephone. So we put you on the phone with a board-certified physician, walk you through a very thorough consultation, and 94% of the time we resolve that issue right over the phone, send over a medication to your favorite pharmacy if preferred or if necessary, and you go on with your day.
How do you prevent fraud?
So how do we prevent fraud from a member level or from a doctor level?
I just call up the doctor and I tell them I'm sick, I don't feel good, I've got headaches, migraines, whatever, send me a prescription.
Well, thankfully, we have virtually zero fraud on our system today. So people realize that they are connecting with a doctor, and this is a healthcare professional,
right,
and they're not calling just to chat and waste time. They're really calling because they've got an urgent care issue that they need to take care of.
Okay. How do you screen the doctors and how do you screen the users?
So the users have access to our membership typically through an employer group. So it's part of their benefit plan. You can buy the service outside of an employer group for yourself, just to use. And then the doctors follow a very strict accreditation process. So we follow NCQA standards. Doctors have to have a minimum number of years practicing in healthcare before they can be on our network. No malpractice issues. And the average care that experience that a doctor has is around 15 years on our platform.
Okay. And tell me about the company. When were you started? Where are you in your evolution?
So we started in the telehealth industry about 7 years ago. We started working with now one of our competitors' products and just found that we felt it would be much better and more beneficial for companies to attack this industry in a different fashion. Mm-hmm. So that drove us to start our own company, and telehealth is a component of what we do, but now we're a technology platform that we can provide all kinds of different information and services for individuals that helps them navigate healthcare. So as an example, you put in your health insurance provider if you have health insurance. It syncs in-network doctors. You can schedule appointments with a face-to-face doctor visit in-network based on your benefits, or you can connect with a telehealth doctor. We show you where you stand with your deductible. You can schedule appointments with dentists, eye doctors, and so on, all through the simplicity and ease of the app.
Tell us about the technology and what software was developed, what operating systems does it work?
So it works on, the technology works on Apple and Android. It was all developed in-house, very user-friendly, very simple. We use some fun technology called geofencing, where we actually geofence all the expensive doctor office locations, so urgent care centers, emergency rooms. So when you walk in there and you may forget that you have Healthiest You, it pops up a reminder and says, hey, don't forget, Jeff, you got Healthiest You. And you can connect with a doctor for free and do that consultation and maybe avoid that long, expensive visit exposed to all those other germs. So everything was built in-house by our Chief Technology Officer and a team of folks. So it's definitely a proprietary program that's not templated out there anywhere today.
And what software development code was used? What platform is it built on?
I told you should be. That's a good question. Yeah, we'll have to cut that part.
We'll just cut it at the end of that, so just turn it off. Yeah. So what's